Good morning, everybody. I would like to welcome all my European partners and close collaborators in this meeting. It's an honor to have you here. And this conference is not a Greek Cyprus event, we won't speak in Greek from now on. We speak in English, so everybody can understand without translation. So, thanking the collaborators, I look forward to the close meetings that will take place here, especially for the XTHR joint action, which is aspiring to help actively the application of the European Health Data Space Regulation, which has just been voted completely, I think the 15th of January. But we've been working on it for over a year, preparing for the implementation acts. And in this respect, we like to thank the officers that are here. We have Mrs. Christos from the HADEA representing EU today. And today we're going to have Ms. Raffaeli from the SANDE. This way we're going to support with the meetings the application of the European Health Data Space Regulation. I will give my talk. It's not going to be as I imagine, because facilities here are not helping a lot. This podium is designed for a giant, and I'm not. So, and also the technology. So I will try my best to do this, and bear with me. Yes, this is my title: European Health Data Space Regulation. Paving the European Health Union. This is the correct title. Anyway, let's gain my spirit again. The treatment of the concept of e-health, of health in Europe, has ancient roots and a continuity of centuries. How were these the ideas we have about health in Europe form that led to today? The voting, of course, of the European Health Data Space Regulation is a cosmogonic event. It didn't just happen like that. It's not just another law, one of those parliaments vote every day. It's a very fundamental. And if I could, I would invite Hippocrates today to talk to us about this matter. We'll see that we will need his intervention in various parts of our lecture today. Since I cannot, let us simply refer to his works and quotes. 17 centuries later, his oath is used repeatedly, adapted for Christian doctors, in this case, because it contains many of the universal values that medicine has served since then until today. This new idealism that the rise of Christianity brought about was in concert with Hippocratic ethics. From the many existing manuscripts of the Hippocratic works containing the oath, W.H.S. Jones considers that the oldest is the Vaticanus Opinates of the Christian oath of the 10th century, which is very different from the other manuscripts that contain a modified version of the oath so that a Christian may take this vote. the continuity of medicine through the ages, and here we have Hippocrates converse with Galen. This continuity and the tradition of universal values through the centuries can be seen if one studies the evolution of medicine in Europe. Here I show only a few of the emblematic personalities that serve medicine, serving human and his ideals and values, with influences also from Egyptians, Hebrew, Assyrians, Phoenicians, Arab communities, etc. Only some of those who influenced and shaped the field of medicine in terms of man and his health care at various levels, inspiring the following eras in the improvement and development of medicine. Thus, handling over one era to another, the chain-wise reaching today with the maturation of ideas about human and his health. These ideas are the following, and I went through those pictures you have seen: Hippocrates, Galen, Basil the Great, School of Salerno, Paul of Aegina, Avicenna, Michael Psellos, Moses Maimonides, Guido Montpellier, Roger Bacon, Giovanni Baccario, Andreas Vesalius, Thomas Sydenham, Edward Jenner, Louis Pasteur, George Papanikolaou, James Watson, and Francis Crick. Respect for human life and dignity. These are the values. Ethics and deontology. Primum non nocere, no harm. Sincerity, selflessness, confidentiality, equity and universal access to health, solidarity and social responsibility, health and welfare systems, scientific truth and the pursuit of knowledge, freedom of thought and expression, patient autonomy, transferring knowledge to others, and training. All these values I experienced firsthand during my many meetings we had the Council of the European Union discussing the regulation. It went through various discussions, and at the end of the day, through these values, we reached a mature and agreed unanimously almost a European health disparity regulation, because it was based on those values over the centuries when in the nations and North European, South European, Central European, Eastern Europeans agreed on a regulation that is based on those values. This is the significant achievement that Europeans managed to do collectively, which gives hopes to the new term European Health Union. So collective perception. All these values are expressed through the cultures, ethics, perception, knowledge, and experiences of the peoples of Europe that also shaped the attitude of European citizens towards health. At the same time, technological discoveries have inevitably guided the thinking of citizen scientists to new means and ways in which they could serve health, calling it electronic health, e-health, which comes to promote the health of the citizens of Europe by stepping on the same values and building on their own knowledge, culture, ethics, and perceptions. We will stop using, of course, these terms, and I used to tell my students the term e-health, when it becomes synonymous to health. So when we say health, we mean e-health. That's the aim. This is what we are working for. Can you change the next slide? I give you the, so I don't, the previous, yes. Okay. I give you the sign is better. Each member state brings with it ideas that are accepted and valued by its people, rooted in the human values that characterize each nation. And these ideas carry elements of the culture of each member state, the collective perception it upholds, and the knowledge and experiences it has accumulated. These contributions are brought to the dialogue which, through the appropriate exchanges and interactions, leads to resolving issues in a way that results in a common approach to promoting health. This became the cornerstone of the foundation of the European Health Data Space legislation. Within this framework, disagreements are documented and ultimately found common ground, paving the way for a common approach to health promotion in Europe. This process marks the beginning of the European Health Union era. Citizen is positioned at the center, but what is a citizen? What is a human? And this is from Hippocrates. I envisage this. Ουκεν ιατρικήν ιδένε, ως της μη είδεν, ότι εστιν άνθρωπος. We cannot talk about medicine unless we know what is a human. So many years ago. And I imagine Hippocrates walking in this area, even though he lived in Kos, it's known, but during the plague in Athens, he was actively involved, I think in the 300 before. So he lived in Athens at some stage and probably walked in this area. I imagine him being around us. Therefore, we have to look at the human through a lens of the European Health Data Space Regulation. And actually, this is a woman wearing trousers. Don't misunderstand that it's a man. Next slide, please. So what we're looking through this, at the human, to know human, we look at the data that is coming from the human. This is what we're looking for. So the European Health Data Space Regulation is looking at the data coming from the human. So the data describing what is a human, their history of health, and their trajectories. To simplify the regulation, we talk about, I'm a very patient person. Can we go back to previous slide? Okay. Next one, please. It's fictitious to talk about regulation and dividing this into primary and secondary use. This stands for practical purposes. It's only for primary use. Secondary use is there just to facilitate primary use. I'm not going to analyze further. Let's go to the next, please. And the idea of the regulation, when it's applied, is to elevate human being to the previous, to achieve trust, quality of life, and safety. This is the aim of the regulation. Next one, please. And Europe puts the regulation across all countries uniformly in order to make practice what is aimed the European citizen, wherever, beyond geographical problems or barriers to applying the regulation. And common approach to achieve the European Health Union. Again, Hippocrates, to explore this, let us turn to the foundations of modern clinical medicine established by Hippocrates and followed. By examining the concept he introduced, many of which continue to guide healthcare providers today, we can better understand how health interventions are approached for the benefit of citizens. And this is prevention. He said that is ασφάλεια εστίν το προνοήν και προλαμβάνει. Το δε προνοήν και προλαμβάνει κρίτον εστί του θεραπεύει. I said not to talk Greek, but this is Persian Greek. It means to prevention. It's better to prevent than curing. And I think Hippocrates inherited this from previously from Asclepius, who said it's better to spend 1 cent like in prevention than 100 cents in curing. That's again the idea. And how we achieve prevention through the regulation. We have there the European, the electronic health record, which is the cornerstone of e-health, which is accessible by citizens, pharmacies, medical centers, healthcare providers, diagnostic centers. All this together, we come now to see the power of data. Consider health data as fuel that drives the engine of health technology and industry, AI, policy and regulation, and secondary use, shedding light on various facets of human health. Establish a consistent and efficient framework for the reuse of health data in research, innovation, policy making, and regulatory activities to promote health at both the individual. Electronic health data. Electronic health data space embraces a comprehensive definition of health data, including, for example, electronic health record or registry data, factors affecting health, such as socioeconomic status and environmental exposures, trial data after trial completion, genetic genomics data, and data from research cohorts after publication of these results. All these are shading into the applications of the and enhance and indicate the data power that elevate the human through these technologies. The secondary use of health data powers the engines of AI, policy making and innovation in the health sector, driving technological advancements and industry growth, and this provides citizens with significant opportunities such as reduced healthcare costs, greater flexibility through geographic independence, and seamless data sharing the exchange. Will the citizen take this opportunity and use them to open the door to European Health Union, empower individuals to control their data? The road to harnessing the power of data lies in prioritizing citizens empowerment and trust, not just because the law requires it, but because citizens believe in the EU Health Union and want to succeed. Citizen empowerment in the context of the European Health Data Space Regulation resolves around granting them control over their health data, ensuring they have the power to decide how it is used, including the ability to grant or revoke permission. Transparency, of course, is critical, as citizens should be informed about how their data is being utilized and provided with meaningful insights into significant findings delivered from its use. Furthermore, citizens should be enabled to actively participate by accessing and utilizing their own health data, allowing them to play a proactive role in managing their health while contributing to research and innovation via secondary use. While improving the health of citizens at both personal and community levels is the central focus of the European Health Data Space. Broad participation from other EHDS actors as essentials to ensure its success. You can see them all in a broad participation and collaboration. Who is responsible for the citizen engagement and broad participation at national levels? It's anticipated in the regulation that per member state there's be a digital health authority. In Cyprus we have it the National e-Health Authority, and the Health Data Access Body, which is another body to be established in each country for exchanging the so-called data for secondary use. The Digital Health Authority and the Health Data Access Body being the central actors in the establishment of a single market for digital health services. Which are the requirements for the single market? We say interoperability, security, standardization are all main activities to be done. And of course, the XDHR joint action is addressing mainly of this in order to facilitate the correct implementation of the European Health Data Space regulation. For example, interoperability, we have the European EHR extended format, which has been established. We are working on this and address the various issues of interoperability. It's not just a technical issue to communicate. There are matters to be addressed, legal compliance, data exchange standards, certification and labeling, training, documentation, etc., etc. All these have to be addressed. And, of course, the XDHR is aspiring to develop and suggest this format in a form that it can be actually implemented, not on paper. And I depend very much on my XDHR collaborators together to deliver this next year in April, when the official end of the project, to have them ready and address. And how this stand in a European level, I put, of course, Cyprus there, but it can be any country. Parallel to these initiatives, the joint actions, we have a number of projects. Some of them are represented here, and they are all collectively working for primary and secondary use, aiming to help the application of the European Health Data Space regulation. And the aim, all this I envisage in this plant, 2 plants that are fed with data. They are growing for primary use, diagnosis, prevention, monitoring, therapy. For secondary use, education, innovation, research, public health, monitoring. All these serving national EHR, mobile apps, AI, EU cross-border services, health data access bodies, all collectively are aiming for FZIN, good life, help the citizen. This is the pictorial way of this. And of course, if we look at it at the European level, the dream is they, just serving equity, become stronger together. The nations participating with hopes, and this is a personal view, but I think it's possible. This beautiful European health data space regulation, it can produce seeds and ideas. These European fundamental human concepts and ideas to fertilize the rest of the world and make possibly the European health data space regulation universally accepted. The first ideas that we're trying to promote this is to adopt the International Patient Summary as the standard for Europe and the rest of the world. This is the beginning of exchanging data across the world, and in this respect, the WHO is supporting this idea. So the aim that the European Data Space Regulation, we bring to the citizen this eventually, not today, but in few years, but we have to pave this way. Having said this, I'd like to thank you for my attention. Thank you for your attention. Apologies for not performing as I wanted to because of the betrayed by the technology. Nevertheless, I am happy that I gave this talk to you, and I would like to invite Ms. Angeliki Angouridi to coordinate the discussion afterwards. Thank you very much.